Hi everyone, I'm Molly. I'm one of Pinar's students. I'm a senior here at the U and I'll be graduating in May with a degree in health sciences and health administration, so this is super exciting for me. I'm here to introduce Mark Hansberry. He is a Senior Vice President, Chief Strategy and Marketing Officer at HealthPartners, responsible for strategically positioning and growing the organization. In this role, Mark is accountable for organizational business strategy, product development, business development, brand management, marketing, communications, and digital experience. He has more than 30 years of experience building innovative partnerships, products, and business ventures that attract customers and grow revenues. Mark joined HealthPartners in 2016 as Vice President of Business Development, where he led the planning, development, and implementation of initiatives that supported the organization's long-term growth. Prior to that, Mark spent over a decade at Fairview Health Services, where he served as Senior Vice President and Chief Strategy Officer. His experience also includes leadership positions at Boston Children's Hospital and Advocate Healthcare in Chicago. Everyone welcome Mark Hansberry.
Thanks, Mary. Good afternoon, everyone. It's good to see everyone. Thanks for coming out for the conversation today. I thought I would start, before I get into my slides, to talk about inflection points. All of us who have had a career in healthcare or non-healthcare have had different inflection points, and there's three that I thought I would just share that I think are germane today. The first inflection point actually started here at the University of Minnesota. I'm a graduate of the University of Minnesota's Carlson MBA program of 1993, which dates me a little bit. I was actually here before this building is here. So I received my MBA before the Carlson School. This beautiful building was erected here at the University of Minnesota. But the reason I think that that's an inflection point is one of the things that I was required to do as part of my MBA program was to do what was called a field project. And the field project that I did was with a federally qualified clinic that goes by the affectionate acronym of CUC, Community University Healthcare Center, right? I see some people nodding their heads. The physician that led CUC, his name was Dr. Amos Denard. He was a pediatrician in town, and I learned from him the importance of healthcare as a community asset. Prior to my MBA, I was in private equity, and so when I came to get my MBA, I thought I was gonna go to one of the coasts and continue in private equity, hopefully at a higher price point than I came into my MBA at. But Dr. Denard shifted my career in 1993 into healthcare. That's my first inflection point that I thought I'd share. The second inflection point was eventually coming back to the Twin Cities in 2002, meeting with somebody by the name of Dr. Frank Serra. Dr. Frank Serra used to run the academic health services here at the University of Minnesota, and the inflection point that I learned from Dr. Serra, having gone to the Chicago market as well as the Boston market, is he sat me down in my first week, and he said, I want to tell you how the Twin Cities works. He said, in this marketplace, there is something called co-opetition, which is, yes, we compete with one another, but we're a highly collaborative and we're a cooperative community people because, again, at the end of the day, our mission is all collectively to improve the health of the communities that we serve. So I learned about co-opetition from Dr. Frank Serra. The third inflection point, which is very germane to what I'm going to be talking about today, is the question that people ask me all the time, which is, where do you get your inspiration for innovation? And my easy kind of canned answer is everywhere, and that is true, whether I'm traveling abroad for just personal reasons or if I'm actually walking down the street and I notice something. One of the beauties of living here in the Twin Cities metropolitan area is we are surrounded by wonderful organizations from all different industries. And I, in particular, love to follow the retail sector. And we are blessed of having great retailers like Target, Best Buy, 3M. We have a lot of great retailers in here that I draw inspiration from. I'm cheap, and so because of that, I get my haircut cut at Great Clips instead of going to a high-end place for my haircut. Great Clips based here in the state of Minnesota, which is awesome. Went to go get a haircut at Great Clips, and what happened is I learned that you could save your spot at Great Clips. I don't know how many, don't raise your hands, but because I would, as a frugal person, raise my hand saying, yep, I use Great Clips. I draw my inspiration from them. How did I draw inspiration from that? Right now, if you don't feel well and you want to actually go to urgent care after this wonderful symposium, you can actually save your spot at a HealthPartners Park Nicollet urgent care clinic. That inspiration was drawn 5 to 7 years ago from Great Clips, from me walking into a Great Clips in Minnetonka and going, there's an application of this to healthcare. Let's bring that in. So innovation, ideas for innovation are everywhere. They cross sectors, and it's our opportunity to cooperate and learn from others in the industry and out. So with respect to the conversation today about hybrid care, I wanted to first present the opportunity. I love Pinar's challenge of like what keeps us awake at night, what drives us and compels us to do better. I always think healthcare has an access issue, it has an equity issue, and it has an affordability issue. And I would actually strike the word issue and say crisis. We have an access crisis, we have an equity crisis, and we have an affordability crisis, not only here in our community in the state of Minnesota, but across the country. And at this point in time, the industry is being held accountable for those challenges. We face competition from emerging solutions that are disrupting not only our health plan and care group, but also others. Why? Because purchasers, whether they are retail purchasers like consumers or group purchasers that are buying health plans for their employees, they view that the industry is not adequately addressing access, cost, and complexity. Therefore, it gives us an opportunity to lean into this opportunity. Why is this happening? There's 3 big reasons why this is happening. By the way, what I'm sharing with you today, obviously being an individual from HealthPartners, much of this is actually not HealthPartners based. These issues are pervasive across the healthcare industry. 1, we have a supply side issue, and I'll get into each of these here in a moment. The second, we have an evolving mindset happening with consumers in terms of how they think about healthcare, but also how they behave as it relates to the healthcare of themselves or their families. And then finally, consumers and purchasers, and by the way, they didn't just start saying this. They've been saying this for a long, long time, that healthcare is too expensive and it's too complex. One little historical note, HealthPartners was founded in 1962 as a staff model HMO. It was started by a physician, a banker, and a loan officer. It was started because the #1 reason in the United States for household bankruptcy was healthcare. Guess what still is the #1 reason for household bankruptcy? Still the same issue. We've got to fix it. There's a lot of money in healthcare. It's the second to the Department of Defense to our GDP. We have an opportunity to actually lean in and address this crisis that we have from a cost perspective. So as I mentioned, I want to walk through each of these. And these data are actually pertinent to HealthPartners, but my suspicion is if I went to other systems in the community, we would find very similar issues. The first is we have a supply issue. Why? Well, we have clinician shortage issues. It's wonderful that the University of Minnesota continues to produce very strong and well-trained physicians, pharmacists, nurses, et cetera. But the challenge is it's just not keeping up. It's not keeping up with retirements. It's not keeping up with the personal choices that physicians are making in their how many days a week do they want to work. And fewer people are going into the field than did go into the field in the past. How does that translate? Well, it translates to everything that you see to the left, which is, on average, it takes about 17 days to get into a primary care visit within the HealthPartners community. About 37 days for key specialties that we offer. So we have a supply issue. The demand is too significant for the supply that we have to care for. The second reason it's happening is an evolving mindset. Historically, and in fact, many people would think, and I'm married to a family physician, and so most people think, oh, I'm actually relatively monogamous with my primary care physician. That's just simply not true. When you look at the data, even though primary care physicians would love to say that their patients are monogamous with them as a primary care doctor, that's just not the reality. When you look at the data, patients go where they have access and capability to see a clinician at an appropriate interval. So even though their visits may have historically been along the primary care vein, they're actually now seeking care in a variety of different ways. One of the wonderful things about being both a large care delivery organization and as a health plan, we get to see this data in real time. We watch how patients use healthcare, and we've tried to figure out how to actually impact those inflections. Cost. I don't really have to talk about this when all of us experience this as consumers of healthcare. You know, if you ask, is healthcare affordable, I think I would have a unanimous no in this room. Consumers and purchasers are looking for more affordable solutions. They want not only cost estimates, but they want us to be able to help manage the increasing scale of healthcare costs and address that cost inflation over time. Okay, when we approach innovation, oftentimes in many communities, including the HealthPartners communities, we always start with, how might we? And here we say, how might we create capacity, affordability, and differentiation in this new reality? Capacity within our care group to serve yet even more. Affordability, how do we lower the price point associated to care? And how do we use this as a way to differentiate the organization from others? Earlier this year, we introduced what we called hybrid care. And we referred to this as the future is hybrid. You would ask, okay, Mark, you talked about Great Clips going in to get your $14 haircut, nice job. And you talked about that being the inspiration of Save My Spot for your urgent cares. Where did you get the inspiration from hybrid care? Well, if you think about prior to the pandemic, a lot of business was conducted online or it was conducted in brick and mortar. And I remember having a conversation with a few people from the Target organization, and they were talking about the warfare that existed in Target in terms of the Target.com people and the merchandisers. They didn't like each other, they didn't want each other, they kept each other's business separate, and in fact, they looked at each other almost as internal competitors to one another. I thought, that's super curious. Then, they actually started to think about, how does Target win? And you started to watch this as a consumer. Consumers would be able to start their shopping journey online at Target.com, start shopping for products that they were looking for, create a basket. Some of you are starting to nod. They would then say, gosh, you know what, I don't want to wait for 2 or 3 days for this to come via Amazon. I want this now. And you'd be able to then put that basket into a Target store, and that Target store would have somebody walking around in a basket, putting your things in that basket, and they would meet you upon the curbside to put all the things in your car that you wouldn't even have to leave to be able to get your goods and services. Great model, right? That's a hybrid experience. You started your shopping journey online, and you completed that by pulling into a Target parking lot. Much of what happens in healthcare can be done much of the same way. The pandemic encouraged us to start thinking differently. So on the left, you see a variety of different assets that we at HealthPartners possess. We have smart interviewing technology that we can actually build analytically, so that what happens repetitively in a clinician's asking of questions of a patient can actually be done something that is coded and built so that it's actually something that can be viewed as an online questionnaire. We have labs, we have specialty care. We also had this capability that was created about 12 years ago called Virtuel, which provides people access to low acuity, high frequency types of conditions like UTIs, sinusitis, et cetera, for about $49. Pretty cheap. And many health plans actually just pay for the thing outright. So we thought, this is a jumbled up mess. And quite honestly, this is an honest reflection in our product portfolio at HealthPartners. We said, these are a lot of great assets, but they're not organized for the patient or member. We spent some time organizing that, connecting that, building data pipes and technology stack that supports a unified experience so that we can create a hybrid experience where somebody may start their journey online, but actually complete their journey in person and then go back to the online version for information about their visit or their billing. Now I'll tell you, and this is reflected in the very bottom, our first use case was to start with preventive care. We started with preventive care because we knew if we started with something else, we may have some challenges with our clinician group. Preventive care is something that most people don't push back on. You know, do you think a woman needs a mammography on a regular basis? Most people would say yes. Do you think that people need a colon cancer screening on a regular basis? Again, age appropriate and all that kind of stuff. Yes. Do you think people should have vaccinations for MMR, for polio, for things like that. Yes, those were things that were givens clinically. So we built a hybrid model that allowed people to start their journey through an online questionnaire and complete their journey by coming in for lab tests or for an inoculation or for a colonoscopy, depending upon which of those preventive care visits was there. Interestingly, in that first use case, in that preventive, and I'm being a little bit vulnerable, I would say we belly flopped. We have high standards at HealthPartners. We wanted a 4-star, and we got a 2.5. We belly flopped, completely belly flopped. We were like, what in the world is happening? Here's what happened. Although we had vehement agreement between our health plan and our care group of what defines preventive care, who did we fail to ask that question to? Consumers. We failed to, even though we had vehement agreement between the plan and care, consumers were like, wait a second, that's not how I define preventive care. And if we were smart, we should have known. Because if you're a primary care physician seeing a patient that's coming in for a preventive visit, oftentimes what happens is that patient says, you know, Dr. So-and-so, I also have this hangnail that I've been dealing with for the last, or I've been having real problems with my back. And for most people in this room that are clinicians, you kind of know what I'm telling you about. And that's a gotcha moment, because that creates a second billable moment for most people's visit. We knew that. We should have known that. We should have designed it differently. And we did. And I'm not going to elaborate how we did and what exactly we did, but you can see our preventive 1.4 is improving. We're not where we need to be yet. We're at a 3.6 stars out of 5, and we are woeful in terms of willingness to recommend, but we're making really good progress. The beacon of hope for us is we launched acne care. If anybody has tried to access dermatology in the state of Minnesota, or quite honestly any other state, derm is usually one of the most problematic specialties to access. Part of the challenge in dermatology is there's a lot of care going into dermatology that doesn't need to see a dermatologist. Consumers are really not good consumers because they don't really know when should I go in to see a dermatologist versus when can I just go see my family physician for that acne treatment. Hybrid preventive care has allowed us to alleviate some of the congestion in our dermatology practice, and quite honestly in primary care, by actually funneling patients, new as well as existing patients that require acne care and acne prescriptions, into a hybrid experience that creates an in-basket with a mid-level clinician that is able to administer and prescribe the medication for that patient in a reasonable time frame. You can see we hit a success on our second use case at a 4.6 out of 5 stars. This has hit a home run partly because of the fact that the audience that this one heavily focuses on is tech-enabled. These are young people that are used to using their devices, taking snapshots of their face, and submitting that for a clinician to be able to look at. We are far from fulfilling this journey. We are at the very beginning. We've learned a lot. We will continue to learn a lot. We have use cases already being built for 2025 and beyond, but we truly do believe that the future is hybrid. Thank you. So I think I have a couple minutes for questions, and I'll be around for the cocktail hour too.
Definitely. So we can take some questions for Mark. Thank you so much.
Wonderful insights there. Thank you so much. I'm Keshavan. Just a quick question. You thought about preventive. Did you also think about post-operative care?
Yes. We actually think some of the biggest use cases, quite honestly, space are going to be focused on chronic care management. And again, for folks that are in the healthcare industry, you know this, but oftentimes the way that most health systems manage chronic disease, if somebody's put on a statin as an example, the way we ensure that we're managing that chronic disease, like the kind of the blocks and tackles, is having that patient come back every 6 months to get their prescription refill. And that's a way for you to be able to check on lab values. It's a way for you to check on a variety of weight, gain, et cetera, for the patient. Those are important touch points. We don't think that those touch points necessarily, number one, need to be done by a physician, and number two, need to be done in person.
Hi, again, thank you. Great presentation. Jitesh, and I have worked in the med device industry for a while in the pharma. My wife is a physician, endocrinologist, and a real life example, I think she tried to do like a hybrid 50%.
Yep.
50% of 50% fell off the calendar. And they said that this is not going to work for me. And so I feel like meaning it will work, but may not work consistently with all specialties. And I don't know what your thoughts are. I mean, you already kind of gave a couple of examples, but I feel it all depends on the disease category that we are talking about, the patient profile, and it's not a one-shot approach that will work.
I really appreciate the question. And one of the things that we learned when we went to online scheduling is there are simple use cases for online scheduling and there's really complex ones. We've been mindful because we went to online appointment scheduling about 10, 12 years ago, and we continue to proliferate that through a variety of specialties. We've had to pull back from some of online appointment scheduling because of the complexity of the scheduling. That's my first point. My point is that learning, though, has now come into hybrid, which is we have to make sure that we're building off-ramps as well as on-ramps. So if the hybrid experience is not working for a patient, we need to make sure that there's a clear off-ramp for them to be able to see whether it's a virtualist, so somebody that can actually pop up on the screen in a video visit, or we can softly land them into an in-person appointment.
Hey, Mark. Heather Britt with the Wilder Foundation in St. Paul. We are huge Health Partners fans. We've been a Health Partners partner for decades. Huge fans of St. Paul. We just had an executive team meeting this morning where we talked about what our costs for next year are going to look like. So you all have been great to us. We're a nonprofit. You've held us at zero for the past 3 years. That's been amazing. So you take great care of nonprofits. I don't want to suggest you don't. But our next year increase is 8.9%. Help me understand how all of this is going to translate into us as a nonprofit employer seeing the cost of care go down over time. What's your vision for that? When's that going to take effect? What can I be excited about as an employer?
I really appreciate the question. Boy, I've been reading literature, listening to quarterly report outs from a variety of different organizations and looking and observing at our own trend. Medical trend is high across this state, across this country, nonprofit, for-profit. I think we all equally share in that space. It's trending in the double digits right now, far beyond what the predictions were by places like PwC and others. Here's what I would say is I think what HealthPartners has done a phenomenal job of over the decades is figuring out how to better integrate the work of health plan, we call that coverage, with care that is provided to those members. So this integrated care and coverage model is where I believe we've been able to be very successful to bend trend. But to answer your question fully, what's super curious is the same comment I made about preventive care is we need to think differently about how we engage the end user. And so part of the hope and aspiration that I have around things like hybrid care and a variety of other things that we're doing at HealthPartners is how do we not only engage and educate, but more importantly, how do we empower consumers to really behave and operate as consumers with the right information at the right time being presented to them so they can make a good defined choice for themselves. I really believe that we need to add to the ingredients of connection of provider and plan. We have to create the purchaser in that regard, whether that's an employer or the consumer. I think there's one more. I hope that answers your question. And thank you for continuing to be a good partner. Appreciate it. One more over here on the far right or left for you.
Thanks, Mark. You mentioned 3 areas. One is that supply chain. and a huge shortage, which you're showing that's starting from 17 days to more than a month. And it's linked with Heather's point of the costing thing. So how you see and what's your experience working with this virtual care and digital care? Which way you see that's going to help or impact the shortage of the manpower which the state have?
Yeah, that's a good question. So I'm going to throw out a couple statistics here. The first thing I would say, and I'll just focus on primary care, defined as family medicine, pediatrics, internal medicine. And I've studied this not just within our own group practice, but in other group practices because of the claims data that we're able to look at. What's super curious to me is that today, if you look at the majority of primary care groups, whether they're employed or independent, somewhere between 25 and 30% of the clinical activity at in those primary care settings are in conditions that today don't require an in-person human intervention. I think what's super interesting to me is if we could think about how we can actually take 25 to 30% of what's congesting primary care, and I'm just talking about primary care alone, I'm not even talking about the follow-up care that I was talking about relative to chronic disease. If we can actually use technology in new and proven ways appropriated to this space, I think we're going to create some capacity that is far beyond any kind of incremental capacity that we can generate through familiar or traditional models.
Thank you, Mark. I think I would like to have some follow-up conversation outside once we get time.
Perfect.
So definitely
Perfect.
there's some scope of these technologies and which way we can do that.
That sounds great. Love it.
Thank you. By the way, for my undergraduate students in the audience, Ikram is our TA. Say hi to Ikram. Thank you so much. And now I would like to introduce my student, Will Conlin, who's going to introduce our new speaker.